When it comes to a breast augmentation, there's a lot of questions that need to be answered for patients. We need to find out what their goals are, we need to find out their anatomy and where our starting point is, and then we need to figure out how to solve the problem of getting them where they want to go. To do that, I really have to consider a lot of things. I have to consider what size they're starting from and where they want to go. I have to consider their body type and natural shape, and whether I just need to fill it up or I need to make changes to really get a beautiful result. And then I need to think of the technical things that go along with that. Where am I going to make an incision? Where does the implant actually need to be placed? It can be over the muscle or under the muscle, even a combination of that. And which implant out of the many, many combinations that exist is going to be the best one to get that done. Because some patients come in and that result needs to be very natural and conservative, and some patients are on the other end of the spectrum and need to come in and have kind of an augmented look. And my job is to understand those things, to achieve those goals, and to make it medically smart. Because I hope these patients have their breast augmentation result for a long, safe time, and the devices today allow that, so I want them to make a smart decision. Not just fill me up, but am I gonna like this breast, this result, this look for a long time? When patients come in my practice, they're typically coming with the idea that some girlfriend told them they were gonna be miserable, they were gonna be in pain, they weren't gonna be allowed to move. All of those things are wrong. Today, it's a surgery that's bloodless. It's a surgery where patients move right away. We literally have our patients stretch in the recovery room every hour afterwards, because it's like a workout. If you stretch after a workout, you don't have as much pain, you don't get tight, you don't need medication. Same thing for surgery. If we can get you moving early, back to as close to a normal life as soon as you can, patients actually do great. And all the expectations that they come with, things that their girlfriend has said or somebody else experienced, don't happen. And it's such an easier process than what most patients expect. People think of breast augmentation as a simply cosmetic procedure. It's elective, you don't really need to do it, it's just a personal choice. But for other patients, I feel like they've never been happy with their breasts, whether it's size or shape or they're not even. And it's one of those surgeries where this can be really life-changing. They will wear clothes they've never worn, they'll put on a swimsuit, they'll be more comfortable if they're intimate. And I think that for those patients, the results are amazing. Not just the outside, but the inside. And for me, that's what's so important. I've literally had patients in their young 20s, and I've had even patients up to 70 years old have a breast augmentation that they had wanted forever and never did, and then finally came in and did it because they were healthy and in amazing shape, and they were some of the happiest people after that. It was an amazing experience for them.